There's a lot of confusion about this topic. So here's the problem. You just went through this care conference. We're trying to get ready for a discharge, and you've been flooded with all these different things that are about to happen. And somewhere in there, you heard someone say something about home health, and you probably also heard someone say something about home care. But when you hear home health, you kind of tuned out and said, okay, good, I got home health. It's really important to understand that there is a very distinct difference between home health and home care. Hi, my name is Phil Natsiopoulos, and today we're going to talk about the differences between home care and home health. So what does insurance cover and what does insurance not cover? These are very important. You heard the term home health, you heard maybe rehab or PT, OT, different things, maybe a registered nurse coming out. And usually the first time you hear that, you're thinking, okay, I got the whole week covered, we're all set. It's really important to understand what health insurance can cover. And the big thing here is to understand this. Health insurance covers anything that a doctor orders. So what can a doctor order? A doctor can order a physical therapist to come to the home, an occupational therapist to come to the home, a registered nurse, a speech therapist, wound care, all kinds of actual medically licensed people that are going into a home to provide ongoing rehabilitative medical care. What insurance doesn't pay for is something that a doctor does not order. For instance, if your home health people come out for 2 hours or 4 hours a week, what are we doing with the rest of those hours? Those hours are not covered by home health, and they're not covered by insurance. Now we need to figure out how can we get someone in to be with mom or dad or whoever our loved one is to make sure they can safely live at home with as much independence as possible. And those are things that we look at for home care. And that is something that we call private pay. It's coming out of someone's pocket, but not your health insurance pocket. So when we're thinking about those other hours in the rest of the week, we want to talk about what's called ADLs, or activities of daily living. The things that all of us do every day, irregardless of who we are. We all go to bed, we all wake up, we all get out of bed. We all find a way to go from bed to bathroom, from bathroom to kitchen, from kitchen back to bathroom. We all bathe. All those things, in normal world, we're not asking someone to help us do those things, but now that we're rehabilitating, we're trying to get back to some type of normalcy, it may be that those things can't be done without someone there. That's where home care comes in. And unfortunately, as mentioned earlier, that's where insurance stops. That is coming out of a different pool of money, usually out of your own pocket, or if you have long-term care insurance, or other sources like that. There is a meeting place between the two, and here's where that happens. It's vital that once the medical professional comes in, be it the physical therapist, occupational therapist, and so on, many times they will leave behind a sheet that says, please practice these different things so you can continue to get stronger and do these activities better. Where home care comes in is we can support whatever that is. So if it's these 5 exercises, sitting in a chair and lifting your leg, or whatever those exercises and practices are, on a daily basis, we can encourage your loved one to do these activities so that they get the maximum benefit from the medical professionals. Another question, as we mentioned earlier, is what about the hours left after OT or PT or home health is there? That is a question that I believe would first want to start with your case manager or your social worker, so that before they discharge, they can talk to the therapist, and the therapist can say, okay, in this case, we want someone there all the time because there's such a fall risk. In other cases, it's important that someone's there in the morning to make sure that from getting up to getting to the bathroom and getting ready for the day and eating. Those activities need to be covered with someone there, and then doing the same thing in reverse at the end of the day. So having a good conversation both with your social worker and also then your professional like myself, and talking together and coming up with a good plan and a good schedule. So it's important to keep in mind, as mentioned earlier, with home health, you're going to get a medical professional that's going to come to your loved one's home for maybe 2 hours a week, twice a week, maybe a little bit more depending on how many different professionals that come out. When they're out, they're there specifically to make sure that the patient is improving in certain areas, and then they're gone. As we mentioned, then that leaves a whole bunch of hours left over, and that's where the navigation comes in terms of figuring out what the risk is with your loved one being alone, and with that risk, then coming up with a plan of how many hours per day, how many hours per week that an agency needs to be there with a home care specialist. To learn more about working with us, please go to www.alwaysbestcaretacoma.com.